Right. We had to come and look at the facility and to see what service the facility offers and how it will benefit our patient. The whole idea of this facility is to, use it as best as we can. We have a backlog of patients in hospital, and I tell you why that is so. With Melissa, currently all we are doing is emergency surgeries. So elective surgeries are going to be pushed back even more. And they were pushed back for some time, and we were working assiduously to get it on the way. With this facility here, I had a tour of it yesterday. It is a first-class modern hospital with everything. But the way we can tap in it, because of the time limitation, we're going to use it to clear some backlog of our elective hernia and cataract surgery. And they have a fully equipped diagnostic service. And we are going to use it to get our backlog CT scans, ultrasound that patients are awaiting at the hospital, and some blood investigation. And we just have 2 days here and then probably another 3 days down in Falmouth next week. And we'll see how we maximize that part of it.
About how many patients you believe will be assisted through this?
Well, I can tell you this. The first list I've had for cataract, 20. I have it here on my phone.
Right.
And they are willing to do 5 cataracts per day and 4 hernias per day, 100 CTs and 40 ultrasounds per day, and any amount of laboratory investigation. So that is what we are hoping to tap into.
What if they test you and they find various things that's wrong with you? How do they treat that?
Excellent question. We are going to have our team present here on a daily basis. So when they are doing cataract surgeries, our ophthalmologist is going to be here, our surgeon is going to be here. So once the results are available, it would be put back in the hospital outpatient department where full follow-up will be done, both for the diagnostics and for the surgeries themselves. So no patient will be lost for follow-up. It's a continuation of service. In fact, when I had a meeting with them yesterday, we were asking them, since they have 8 operating theaters on board and they are only able to do 4 inguinal hernia, I say, I have surgeon available. They can come and do it. But they insist that we will work together. And the togetherness is good because, there will be a language problem as well.
Yes.
So our team will be there. We'll write the notes, write our follow-up, refer it back to the hospital.
So you would consider this to be a blessing then?
I would say after Melissa, this would be a blessing for the people of Western Jamaica. It gives you a lift in terms of the care that you can do for our patients.
After a disaster, there are certain things that we have to ensure that we put in place. We have to get our electricity up, we have to get water up, and of course, healthcare. And that has been critical on the agenda locally as well as nationally. As a result, we have ensured that roadways leading to our main hospital, Corner Regional Hospital, were passable so that persons could actually visit the hospital following the disaster. We also ensured that that hospital got power so that we could serve the patients, and water so that we could ensure that we supply the patients with water where necessary. So in this recovery process, the addition of a floating hospital, if you may, is important to help to serve our locals, as many of them are now seeking medical care, not necessarily because of Melissa, but also because they had pre-existing conditions. And due to the disaster, the burden on our health system here in Montego Bay has been pressured. So this will provide some relief for 3 days at least. I know it will be going around the country, but here in Montego Bay we welcome it. This is a good indication from China, the partnership that we have always had with China, and here in Montego Bay the support that we have received from the local Chinese community, and the ambassador going above and beyond to ensure that we got a stop from this floating hospital. It's called the Silk Road Arc, and this is a good thing for us here in Montego Bay, and it will help in the recovery process.
The ship has lots of different departments. Can you tell us what are some of those areas?
They mostly cover everything. They have latest machine, can detect anything you want, and they have all kind of doctor. We have Western medical, and we have Eastern medical too, like acupuncture, all kind of stuff like that.
Because I saw a number of different plant-looking products on board.
Correct. And for women too, like for example, who are the baby for deliver, they can do that too.
How critical you think it is though for such a hospital at this time?
It's very important, as you know, Melissa. Hurricane is damaging us, so badly, and then a lot of people who have mentality sick and physical body. Sometimes the disease is for many years and they can't find the right doctor. So this is a very good opportunity because they have Western doctor and Eastern doctor, which is the best in the world, right? And then you can get full check what is happening.